I'm going to just share a brief video that provides an overview on Arc Health Services.
There's no sound, Danielle.
Oh.
So Danielle, you'll have to unshare your screen, and then when you go to reshare it, there's going to be a button that you can like slide over for the sound.
All right, hang on. Sorry about that. Oops. All right. So unshare, and then what do I need to do?
Reshare, and there should be a little thing you click on to share the audio with everybody.
Ah, there we go. Sorry about that.
The Arc of Monroe's Arc Health Services has been providing services to people with intellectual and developmental disabilities in our community for more than 20 years. We diagnose and treat across a range of services through our clinic, including occupational therapy, physical therapy, speech therapy, psychiatry, social work, and nutrition. Arc Health Services is an Article 16 clinic that is certified by the New York State Office for People with Developmental Disabilities. Our services are provided at our main site at 2060 Brighton Henrietta Town Line Road, as well as 6 satellite locations, 4 of which are located in our ARC Day programs. We offer high quality care with low wait times, and we provide individualized services unique for each person's needs. You do not have to be enrolled in any other ARC service in order to be seen at our clinic. It can be your standalone service. We even have telehealth options to make your appointment convenient and easy. Our mission is to care for you. At Arc Health Services, the needs of our patients come first. We are committed to meet your needs throughout today and beyond. Partner with us to stay safe, healthy, and informed.
And I just want to jump in really quick. I forgot to mention, if anybody has any questions or wants to have, or starts to think of things as we start going through the presentation, you can either go to the meeting chat and just enter in the questions and we'll answer those at the end, or at the end of the presentation as well. You can unmute your line and ask the questions that way too. So sorry, I forgot to mention that earlier.
Thanks, Matt.
Thanks. Yep.
So Arc Health is located at 2060 Brighton Henrietta Town Line Road, and here we provide psychiatry, physical therapy, speech, nutrition, social work, and one-time assessments. PT, OT, and speech are also provided at our satellite clinics at our Ballantyne, Lambert, Fairport, and CAC locations. So we serve adults with intellectual and developmental disabilities who are enrolled in OPWDD services. Services are provided to individuals over 18 years old who are no longer in the school system. Individuals in ICFs are only eligible to receive psychiatry through the clinic. And here's the fun part. To receive services, a referral is completed and supported documentation is submitted. The care coordinators or care managers are typically the ones who complete the process. However, anybody on the person's team can complete the referral. The referral can be found on our website, which is arcmonroe.org, and the completed referral should be sent to myself for those individuals with the last names of A through K, or to Jenna for the people with last names of L through Z. And the best way to get the referrals to us is through email, and our email addresses are on the documentation checklist. that's also on arcmonroe.org. Okay, so we're able to set up transportation for people who are approved for MAS. Individuals who live in the certified site can't take medical motors as transportation is built into the rate for their site. Those who live in an ARC residence may use ARC transportation between the hours of 10 a.m. and 1 p.m. Anyone who's transported by either of these services must have the ability to be safe without supervision for at least 2 hours, and this should be indicated in their life plan. Okay. Just going to share another video.
The Arc of Monroe's Arc Health Services now offers telehealth visits. A telehealth appointment is a similar experience as an in-person visit, but instead, the patient meets their clinician over a distance. A telehealth appointment eliminates the need for transportation time. You can schedule an appointment that's convenient for you. When you see your provider via virtual appointment, you can avoid the waiting room and relax in the comfort of your own home. We can help you better manage your medication, lifestyle, and any chronic conditions you might have, making it easier on you. Almost every service we offer through our in-person clinic can also be managed virtually through our telehealth services, including speech therapy, psychiatry, social work, and nutrition. There are even elements of physical therapy and occupational therapy that can utilize telehealth. Arc Health Services is an Article 16 clinic that has been providing services to people with intellectual and developmental disabilities in our community for more than 20 years. Our mission is to care for you. At Arc Health Services, the needs of our patients come first. That means care that's convenient and easy to access.
And the telehealth appointments will be offered as long as it's approved by OPWDD, and we don't know how long that's going to be. Okay. Masks are mandatory for everyone. Temperatures and screenings are completed at the door. And due to limited waiting room capacity, the staff are asked to wait in their vehicles. If the person requires supervision, then the staff member may wait with them. Okay. So services are approved and treatment is monitored by the medical director, who is a board certified physician. All of the clinicians are trained and certified or licensed. And here's a list again of the services that we provide. Please note that the evaluation that's done for autism, the ADOS, is for the purposes of OPWDD eligibility only. And Jenna is now going to talk a little bit more about each of the services.
So to start with physical therapy, some things people might come to physical therapy for are evaluations or training related to gait, balance, obesity, or an injury. For PT services, we do require a script from the PCP, and PCP faxing over a script is not considered a referral. We have to have our referral completed to go along with the script and the other documents.
As a physical therapist, the basics start with increasing range of motion, muscle strength, balance, and walking. We get involved with increasing transferability and the balance that goes along with being able to be safe and independent, walking in the community on different level surfaces, whether it's for your school or job, or just with your family on outing and a picnic. We also treat people with pain, whether it's back pain or leg pain, arm pain, and work at decreasing their pain to, again, improve their functional mobility and functionality within physical therapy and within their own self, so they can go about their business doing well and quality of life. Basically, many, many times it comes down to a quality of life.
All right, so another service that we offer that also requires a script be submitted by the PCP is occupational therapy. Again, it's for an evaluation or for like ongoing services, and it's to help with the broad range of rehabilitative techniques that involve movement. helping with functional activities such as bending, lifting, carrying, reaching, catching, pushing, etc. OT is currently only offered at our day habilitation programs, but if somebody really needed an OT service and if they can follow COVID protocols, we can take someone outside of our day programs and have them go to one of our programs to receive the service.
I work for the clinic, but I'm at the day hab location at Ballantyne and at Fairport. I'm working with individuals one by one in the therapy room, working on independence and function. We focus on function, keeping it real. This is really about working with people on what they want to do. We work together to decide on what the goals will be. It's a joint goal decision-making process. I have goals in mind that I want to do, and I try to work them into what the individual wants to do to make themselves more independent. This program is one that has many aging individuals, so maintaining is a good thing. It's about keeping people stable and independent. It is about independence and it's about function. It's functional skills.
So next is speech therapy. We offer individual speech therapy. We have previously used speech language groups, and some of our day hab clinicians do groups as well. Our speech pathologist can do feeding, swallowing evaluations for somebody. We would need a script from the PCP in order to complete that. Speech therapy works on things associated with like alternative communication, speech evaluations, sign language support, and assessing the receptive expressive skills.
So when somebody comes in wanting speech language services, I perform an evaluation, get an idea of their expressive skills, which is how they express themselves, and their receptive skills, which is how they're able to understand and process language and communication. Within the evaluation, I get an idea for what I need to do to help that person. I try to build on their strengths so that they can compensate for whatever weaknesses they have. And that might involve helping somebody develop a communication book. It might involve researching what kind of devices might help that person, maybe a computer program or some kind of augmentative communication device to help that person communicate better at home and in the community. Everybody has some different strength or weakness. Some people might have issues with stuttering. Some people might become so frustrated when they're trying to get their words out, they have to get a handle on how to kind of calm themselves and get ready for conversation. I encourage the people to be themselves, because I'm not trying to get them to be somebody else. I'm trying to get them to express themselves.
For our psychiatry service, it is for medication management. It is not psychiatric counseling. It's only for the use of medication management. She has done second opinions as well. Counseling, probably one of our bigger services we offer. We do individual talk therapy. The person must be able to engage in talk therapy in order to receive counseling. We do offer groups and have in the past. Some of the groups listed, those are examples. Currently, we do have one group that is running via Zoom, and we have another group that we just started for in-person for the first time since the pandemic, and we're looking to build on those as well. Currently, our counseling does have a wait list. We just have gone through some transition, and we're just in the middle of settling it. So just to put that out there, we do have a little bit of a wait list right now. We're hopefully going to get through soon.
social work services at the clinic would include individual and group treatment. So we sort of operate from like a biopsychosocial model, considering a person's biology and their psychology, and then of course their social environment, and sort of looking at all of those factors, how that could influence a person's mental health. And at that point we sort of figure out if individual therapy or if group therapy would be more appropriate. And when they come to us, they can actually learn like tangible skills that can be really helpful for tolerating stressful situations or regulating their emotions, gaining insights about themselves and awareness as to their own responses to situations that might trigger anxiety or depression or anger for them. So it's really about helping them to be able to sort of help themselves when they're encountering situations in their day-to-day lives, to just help them to improve their quality of life. Our services are really open to just about anybody who would be, OPWDD eligible, but it doesn't have to include people who have other affiliations with the Arc of Monroe County. And that's really what makes the Arc Health Services, a unique program, because we can really reach out to the community at large.
Two of our current one-time assessments that we are running is the sexual consent determination and the ADOS. For sexual consent, they must be 18 or over in order to complete it. Otherwise, they're automatically deemed non-consenting due to New York state law. For ADOS, we use it for eligibility purposes only, and only OPWDD can refer somebody to us. It is at their discretion whether or not somebody can have the evaluation. We do not offer psychological assessments at this time. I know we used to in the past. However, with transition, that is one service we are not currently offering. Nutrition. Nutrition can focus on a wide range of things. Again, a person must be able to engage in kind of talk therapy with their nutrition. So she gives education with things like hypertension, diabetes, obesity, and renal failure. For diabetes and kidney failure, we do need a script from the PCP just for those two focus points.
The ARC is really focused on person-centered care. So a lot of what we do in nutrition is based on the health goals established by the people that we are supporting. We work a lot on lifestyle changes and efforts of helping the person that we're supporting reach the goals that they want to achieve. We do value individual food preferences and a person's right to make their own food choices. So we focus a lot on what the person is currently eating and healthier ways that they can enjoy those foods, as well as ways to incorporate healthier choices. It's wonderful to see someone, from day one, a year later, and see all the weight that they've lost, or improvement in their blood sugars and managing healthier blood sugars. Even something, as just eating an extra piece of fruit or an extra vegetable in a day, or having an extra cup of water, going for a 10-minute walk. Even seeing the people that I support make those little changes and also keeping up with those changes as well is so rewarding and definitely one of my favorite parts of this job.
Our typical hours of operation at our 2060 location is Monday through Friday, 8 to 4:30. There are times when providers might be able to meet outside those hours. It's just something you'd have to touch base with that provider. And again, my information, Danielle's information, our referral is listed on our website, arcmonroe.org. I would encourage you to check there often for referrals, as we do update them as we remove a service, add a service, or any other change. And our documentation requirement list is right below our referral. It's very helpful if we get all the information at once. We can get the service started quicker once we have all the documentation we need. If we have to wait for something, that delays length in service. And that is our presentation. So if anybody has any questions, we're ready for them.
All right, so just real quick, I did add that same link that was on the last slide there. I did add it to the chat box. So if people just want to, you can copy and paste it or click on it. It brings you right to the ARC's referral page. And then also to find the ARC Health stuff, it's just scroll down to the bottom, but you can see all the, Jenna was just mentioning the ARC Health referral and then the services checklist. So we do have one question that somebody typed in. From Melody Sutherland. It says, I have a 16-year-old who has borderline high blood pressure. Would he be a good candidate for nutrition services?
Unfortunately, we can only serve adults 18 and over that are out of the school system. So if he turns 18 and if he's still having some issues, we can, but unfortunately we cannot serve teenagers. And also for the referrals, it's better if you email us electronically the referral and the documents, just because we're guaranteed to get them. If you send it through our fax, it's a gamble. You're putting money down on a bet whether or not we're going to receive the fax, part of the fax, or various things.
Yeah, it's a good point. And just for any care coordinators or anybody who does send through the referral, I think a lot of times people are used to sending referrals through our community outreach department, which is what I'm a part of. But for ARC Health specifically, it does go directly to Jenna and Danielle. But on the forms themselves, they do have the information on where to send. So just to keep that in mind too, just so it goes to the right place. I don't see any other questions in the chat box. People, I believe you should have the ability to, some people might prefer to unmute themselves, you can unmute and ask the question for Danielle and Jenna that way too. Otherwise, feel free to continue to type in.
Hi there. I was wondering, how long is your current wait list that you're trying to get through for the counseling?
That is really difficult to say. It's based upon hiring of a new clinician. So if we get a new social worker, it's going to go very fast. But the longer it takes to get a social worker, it's going to be a little lengthy.
Okay, thank you.
Just a general, Krista had a question, which actually I'll be able to answer. What is the next ARC program you'll be highlighting? The next one we're working on right now is for our Day Have Without Walls programming, which is called Community Exploration. So that's what we're working on right now. And probably sometime in late May, that'll be going on. Thanks, Krista.
And if you guys have any questions going forward, I mean, sometimes it's hard to think of something right now. Just email Jenna or I, or give us a call. We'll be happy to answer your questions.
Any other questions or information people would like? And by the way, because we are recording today too, after today, we will be uploading this to like I mentioned, the ARC's YouTube page. Anybody who registered for today who wasn't able to make it, or if you have other family or friends that would like this information, I'll send out the link to everybody who did register. So you should all be able to access it and share it after.
Thanks, Matt.
Thank you. Any other questions before we give everybody back their nice snowy day?
Well, I guess we covered everything then.
Well, thank you, Jenna and Danielle. Thanks everybody for joining us today. And like I said, anything else, just let us know in the meantime. But we appreciate your time and thanks for joining us.
Yeah, thank you.
Thank you, everyone.
Thanks, everybody. Have a great day.
You too.
All right.